Welcome back. This is World Insight with me, Tian Wei. Now let's take a look at the worsening COVID-19 spread in the U.S. with 7.9 million confirmed cases and more than 215,000 deaths. Even President Trump contracted the virus, leaving his political opponents wondering whether he has been working hard enough to curb the outbreak. In an unprecedented move, the New England Journal of Medicine published an editorial signed by all its editors condemning the lack of political leadership in response to the pandemic. The journal said that there was too little testing, too little protective equipment, and a lack of measures like mask wearing and social distancing. Earlier, I talked to Dr. Eric Rubin, the editor-in-chief of New England Journal of Medicine. He explains why they published this editorial now. And I'm joined by Dr. Eric Rubin, the editor-in-chief of the New England Journal of Medicine. Dr. Rubin, what a pleasure to see you once again.
Nice to speak with you again, Tian Wei.
I remember our first time talk was at the World Economic Forum earlier this year. How the world has changed since then. And how the New England Journal of Medicine, some wondered, has changed with your latest editorial. All editors signing on, suggesting political leadership has failed.
That's right. We published an editorial this past week, signed, as you said, by all of the editors, in which we made the case that the best response to the epidemic here in the U.S. was to go out and vote and change our leadership this coming election.
Are you afraid that others are accusing you, which they're already doing, of being partisan?
Yes. Honestly, this is not something we'd ordinarily do. We want to be seen as a disinterested and fair judge of science and clinical medicine. I think we do that. In this case, I don't really see it as politics, though. This is a public health issue. There are many ways that we could be combating this outbreak. Many other countries have used simple public health measures to do that, and the U.S. simply has not. And in the end, we consider that to be a failure of leadership rather than a failure of science.
Are you trying to say you're not here, the editorial, trying to endorse one of the candidates while dismiss the other candidate, which is the incumbent president?
You know, we're a two-party system, so there are really only two choices. Yet we're not saying that we know that the president's opponent, for example, although we were criticizing leaders more broadly, we're not saying that we know that the president's opponent would do a better job. We just know that the current administration and many governors and legislators have done a particularly poor job, and they don't deserve to keep their positions.
You've been talking about, in the editorial signed by all your editors, most of them, in fact 24 of them Americans and one non-American, they all sign on this editorial, and it suggests, quote, "The leadership took a crisis and turned it into a tragedy," end of quote. That's quite an accusation.
I think that this is a crisis. First, let me correct you. Not all of I think we have 3 editors who are non-American who did sign on.
Okay.
But I will be, but I think it is true. This is a disaster. It's been a disaster. It's a disaster no matter what. In every country, we've had a lot of extra people dying because of this, and that was unavoidable. Certainly, if the U.S. had taken all of the measures that the countries with the best responses had taken, we still would have had lots of deaths, but we'd have nowhere near the number that we have now. And so this has been incredibly mismanaged, and mismanagement in this case costs lives.
What do you make of the different factors in the society? The political leadership, let's just say the administration and the government apparatus, and then the branches that are responsible specifically for health and for epidemics or dealing with crises like this, And then there's also the medical community, you yourself included, the scientific community. And then there's, of course, the private sector and also the general public. So what kind of assessment would you give to all of these factors that are interacting and resulting what we are having today?
Let me start with the medical sector. I think that the response in general has been incredible, that people have bravely been putting their own health at risk and that of their families by taking care of patients throughout this epidemic, despite, in many cases, not having appropriate masks and appropriate protective equipment. And I'd extend that beyond medicine to all of our frontline workers, whether they drive ambulances or work in grocery stores and get food to people. So I think that there's been a lot of bravery. As far as the government goes, the government has a tremendous number and quality of scientists. And I think that those scientists have been giving the political leaders the right kinds of information. But they can't act on that information. And so in the end, it's the political leadership that has to make the choices. They also provide the moral authority to convince people to do what they should be doing. So it's hard to blame the general public for their inconsistency in following what should be rules or guidance when their leaders are telling them that this just really isn't important.
What do you make of the fact that science these days has become the opponent, it seems, political opponent of certain factors inside the United States? As a medical expert and also as a scientist reading magazine, what do you make of that?
I think it's stunning. I think that that many elements in our society are pushing the idea that there is no such thing as truth, that everything is an opinion, and it's simply not true. We know in regards to this epidemic, we know how to combat it. There are straightforward things to do. People need to wear masks and stay away from each other. We should have good testing. We should have contact tracing. We should have good quarantine and isolation. We're simply not doing these things because people don't want to believe the science. They would prefer not to. It's shocking to me that this has happened. And again, this is a political question. It's a political, I should say, a leadership question. It comes from poor leadership at the top.
Dr. Rubin, what is next from now until the end of the election, November, or probably even to the days of inauguration? There's likely to be some political turbulences, many suspect, in the U.S. So from now until January, do you think things are going to change much?
It's hard to say what will happen and who will. I certainly don't know who will win the election or what happens after the election. The one big event that's likely to occur is we might well get information back from the vaccine trials and some other therapeutic trials. And that information could make a contribution to our being able to control the epidemic ultimately. But the effect of those is going to be far down the line. It takes a long time to make them and get them out to people. So it will be a little while before they are transformational.
The reason I mentioned about the election and January inauguration is has to do with the timing, because this is also the winter season coincides with it, which is the flu season combined with uncertainty of COVID-19. Now, in the U.S., the death toll, some suspect for every 2 lives that have been lost, there is 1 unreported case possibly of death as well, believe it or not. So what kind of situation are we likely to face in the U.S. alone, for example?
Well, I think that we're already seeing an uptick in transmission right now.
Yes. And
that will likely increase for exactly the reason you're discussing, is that more people are heading indoors. I'm hopeful that we'll have an appropriate response. And I will say that the implementation of public health policy in the U.S. is done at the level of the state, not at the level of the federal government. Mm-hmm. And some states have responded quite well. And I'm hopeful that more will respond well and take some of the measures that they need to take in order to reduce transmission. But it will be a challenge.
Having said that, though, many, Dr. Rubin, have been looking at history and thinking calmly, trying to find an anchor in a way. How should this crisis compare to the earlier crisis related to public health? As the editor-in-chief of New England Journal of Medicine, what do you think that anchor could be, and what kind of comparison should we have now? We are already, let's just say, 10 months into the crisis.
So we have had very few public health crises that have affected the whole globe in modern times. It's really been influenza outbreaks, most notably the one in 1918 that spread throughout the world. But remember, we have public health crises all the time, and Ebola, for example, a much more deadly disease, a much scarier disease, affected multiple countries in Africa on more than one occasion. So I think that there's a take-home message from this, which is once we get through this, and I am confident that we're going to get through it, there's going to be more out there. We are going to have more public health crises, more infectious diseases that can spread, and we need to be aware of that and prepared for it. And this particular outbreak has shown us how unprepared we are. So next time around, I hope we've learned some lessons.
What are the most important lessons, do you think?
I think it's preparedness. And I will point out that in this country, for example, we knew that this was coming and yet really didn't do anything to be ready for it when it appeared on our shores. But there are other forms of preparedness. There are having the platforms to produce vaccines quickly. We should have more of a capacity to not only develop but produce these vaccines for future epidemics, and that means a lot of science between now and then and any future outbreak. We need to have surveillance so that we see these epidemics when they occur or when they start, and have a good idea of what we should be preparing for. And we need to have the infrastructure, which includes governments that are able to respond and appropriately to whatever that hazard might be. Yet it all kind of fell apart, and we need to have something sustainable for the future.
So what have we learned about the weak points or the weak links of science so far we know? Science,
it's hard to call it a weak point, but science isn't fast. Science, the basic biology in particular, it takes a while to figure things out from scratch. Obviously, if we knew more about this class of coronaviruses, we'd be better off. And I think there has been some investment since the original SARS outbreak in learning about coronaviruses. But in general, it's going to take a while to do biology. It's not simple engineering, and it takes a bit. On the other hand, should we be investing in treatments for diseases that we don't have or are quite rare in order that we have the capacity to respond? And I think probably the answer is yes, is that we should have more on board to be ready for the next outbreak. Again, I'm going to go to Ebola. And it took a while to make the investment in coming up with vaccines that were highly effective for Ebola. But we did it, and now we have them. And that cost us money, that cost us time. But should there be another Ebola outbreak, as there was recently, we now have so much better tools for controlling it. And I think we should apply that thinking more broadly, is that it is worth investing in treatments, in prevention for SARS, a disease that disappeared, for MERS, a disease that kind of is smoldering along in the Middle East, caused by another coronavirus, and for SARS-CoV-2, the virus causing COVID-19, even when it goes away, so that we can have the capacity to respond to SARS-3 that comes out, or Ebola-2 when it arises.
Now, there are very different approaches, cultural circumstances, and ways and practices that have been used by various governments, countries, regions to deal with COVID-19 and the crisis at home. How can we reconcile or be able to, link the unknown area so that we could come up with still a global approach, at least a global system that everybody recognizes and can take advantage of, and therefore we would be able to do more interactions in the near future?
The answer is not simple. Ultimately, nations are sovereign, and they're going to do what they want to do. But we can provide a lot more guidance and integration among countries in the public health arena. Right now, we have the WHO, but we haven't given that organization much power, nor the tools to do its job as well as it could. The WHO is not really a rapid response organization, and we've seen that both during the Ebola outbreaks and I think during this crisis, where it has had its own missteps that aren't dissimilar from a lot of other public health organizations. But we need an organization like that. We need someone to provide expertise, especially in countries that don't have that expertise, and to be the sort of a meeting place of countries. The WHO is a consensus organization. It's more of a political body. It serves very important functions in long-term issues. It's not so good at a crisis. And if we're going to have a crisis organization, we have to form and give the capacity to someone to do that. And I think that is important. The WHO is the obvious organization to do that, but it would require a lot of changes.
So you're suggesting a platform is extremely important and essential before we really think about or come up with a real global solution. Is that what you're trying to say?
I think that's right. I think that there are several countries that have very good sort of rapid strike capability when it comes to infectious diseases. But most countries don't have that. And we really would need, because we're global, because infectious diseases don't respect boundaries.
Before we go, your advice to any public figure that have COVID-19 or had COVID-19, what do they need to do when they're dealing with others, or what do they need to do when they're in public, or should they be in public? And maybe some advice for their doctors too.
Well, I don't want to second guess people's doctors because, and I know you're referring to our own president, his doctors have a lot more information available than I do. There are good guidelines from the CDC as to when people, here in the U.S., as to when people are safe after they've been infected. In general, that's 10 days, but there are exceptions to that. And it's irrespective of any testing. So testing doesn't help tell us that people are safe. So there's no one test to tell you that it's safe to go out, but there are very good guidelines, and I hope they're being followed.
Dr. Eric Rubin, the chief editor of the New England Journal of Medicine.